Everybody, welcome back. I'm Tyson. This is the Lung Transplant Experience. Today we're shifting gears a little bit. We're going to go into medication, specifically your weekly sorting of medications. This is a little off the way I normally do it. Normally I've got a teleprompter, helps me with my ums and ahs a little bit. Also, this is going to be basically a one-take video. And full disclosure, I've got a hospital right across the street from me, big windows, so if an ambulance goes by, my windows will pick it up. There's also a fire station close by, a light rail station, so there might be some digging in the background. Now, I've got two different boxes of medications. I've got this box of medications. This is medications I take on a daily or near daily basis. And then I've got this box of medications. This is medications I either don't take anymore or I've got a different dosage of them. I've got things like this is Eliquis. This is a anticoagulant. I had a pulmonary embolism some months ago. This is a higher dosage. I take a lower dosage now. This is magnesium oxide. I take a different form of magnesium due to an absorption issue. So things I keep around just in case I need to go on back on a different dosage. So that normally lives underneath my nightstand. And so it's nice to separate those to make it easier for sorting medications. But I'm going to go over to my kitchen table. It's a different color than my white desk, so that way the pills don't get lost. And I'll do a top-down video, and we'll go through sorting those medications. Let's go check it out. So welcome to my dining room table. First thing, once again, I am not a doctor or a pharmacist, so don't take anything I say as medical advice. Now, when I'm sorting medications, I like to lay it all out into three different, basically, sections. My first section is my anti-rejection meds. These are the ones I need to take every single day, on time, every day. These are the medications I need to take to survive. I've got prednisone, my tacrolimus, my mycophenolate. These are the ones, if I miss a dose, it's not the end of the world. If I miss 2 doses, my doctors are going to say, Tyson, what the heck? 3 doses, they're going to say, you need to get your butt to the hospital right now. And they're going to have a very, very serious talk with me. These are the ones that I should be taking every day. But if I miss a dose or 2, it's probably not the end of the world. But I really do need to be taking them. These are my medications that, migraine medications, D3, calcium supplement, allergy medications. I worry about these ones the least. So I want to make really sure I get these right and get these in the pill box. These ones I want to be pretty sure. These ones I'm the least worried about. Now, pill boxes. This is the first one I got. I don't know if this is what the hospital gave me or if I bought this on my own. It worked. It does its job. I need 4 compartments a day because I take magnesium, and that needs to be taken 2 hours from my tacrolimus. One thing I didn't like about this is that the days wore off. Now, normally that's not an issue because it doesn't matter what day of the week for most of my for any of my medications, unless I have a procedure going on. I had a pulmonary embolism back in September. I'm 11 months out now from my transplant. And when I have a bronchoscopy with biopsies, I need to hold my blood thinner, my Eliquis. So if I have a bronchoscopy on, say, Monday, I need to hold my Eliquis a couple days before. And if the days are completely worn off, that doesn't do me any good. Also on this one, the compartments are really hard to open. I'm 6'4" and 225 pounds, and it's a lot of work to get some of these open, especially when you have to open 4 of them times 5 days a week. So I went on the hunt. I found this on Amazon. I don't know who makes it, but I really like it. Really small, compact. They open up really easily. Fits right in my pocket or my fanny pack. And I'm getting at the point where I can travel again, so I ordered up another one. And I'm going to put a referral link for Amazon, which means I get like 25 cents or something like that for each one of these that you buy. They're only like $7, and it's the perfect size for me. If you don't need that extra day, I wouldn't buy it, or that extra time period. I need 4 times a day. If you only need 2, you can get by with a much smaller one and find a different one. Also, if you have a ton of medications, this one might be a little bit too small for you, but for me, it works perfect. So the first thing that we do, that I do, it's the only time I put in something less critical. I'm going to do my magnesium first. And the reason for that is just so I don't put my important things in the slots that have magnesium, because the magnesium interacts with my tacrolimus, and we don't want any medication interactions. So I'm going to open up my slots that have magnesium first, and we're going to get that out of the way. I'm going to just put this on the side for now. And my magnesium. So, word of advice if you're the caregiver, now you always want to have washed hands. If you're the caregiver, wear gloves. If you're me, who's the transplant recipient, I don't need to wear gloves. But on medications, especially tacrolimus, it can be absorbed through the skin. And it doesn't matter if I absorb tacrolimus through the skin, but if my wife is the one doing the medications, that can be not good for her. When I'm putting medications in, medications that are more than 1 pill per time slot, I'll always put in all of the medications for that time slot before I move on, just so I don't accidentally, only put 2 in when I was supposed to put 4 in. So these I do 3 and 3, then I close it up. Now, another thing you never want to do is top off medications. Reason for that is you can accidentally put the wrong dose in, the wrong medication in, and then you can have a really, really bad time and not even know it. The only exception I make to that is my magnesium. I'm checking magnesium here. My magnesium doesn't come from the hospital or the clinic anymore. I get it from Costco. It is a lot cheaper for me. The downside is it comes in this big jug that doesn't fit in my Tupperware case over there. And when I'm done with the medication, I put it off to the side so that I know everything that goes over here is complete and I don't have to worry about it anymore. All right, so now what I want to do is I want to basically work kind of left to right and go through my most important ones first. And the first one I'm going to do is my prednisone. I take 10 milligrams a day right now, 1 pill in the morning. And it's a little white pill, and you can easily get this confused with a lot of these other ones. So that's the first thing that I'm going to put in. Number one, it's important. It's one of those medications I've got to take every day for the rest of my life. And number two, I want to make sure that I know darn sure that it's in there. So prednisone's done. I'm going to set that over there. Cool. So I'm going to go to my tacrolimus. Next thing I'm going to do is I'm going to put in, right now I'm on 3.5 and 3.5 AM and PM. This is a 0.5 milligram pill. I'm just going to double check my compartment here. Actually, I just got to refill 0.5 milligram. There we go. Forgot about that. So you always want to use your old medications first. Oh, I got one day worth in here. So there's my Monday, 0.5 milligram, 0.5 milligram. Now, when a pill bottle runs out, what I like to do is I like to set it upside down over here. So that's my visual indicator that I've got a bottle that's out. And I always double check that at the end to make sure I've got a replacement. Now, I do have a replacement bottle, 0.5 milligram tacrolimus here, but I will double check that at the end. Because once again, these are the medications I need to survive, and we want to make sure they don't get messed up. Another big tip, never let yourself get distracted when you're administering these medications. You don't want to lose count. You don't want to think you put a medication in and forget. It's really, really easy to do. Don't talk to anybody. This is actually my second take doing this. I recorded one last week, and in the middle of it, I screwed up and forgot what I did for medication. So I've got all my 0.5 milligram tacrolimus in here. Gets me a real easy way to look and just go, okay, these couple pills that are important, I can look in there and see that I have them. Now I'm on my tacrolimus 1 milligram, so I'm going to do 3 and 3. It's always a good idea to check your bottle and make sure it's the right pill, the right dosage, the right time. And I think I only put 2 pills in there. I did. You cannot double check enough. And I don't know about you, but my tacrolimus, These tacrolimus tend to kind of stick, and I like to listen. I like to listen for them actually hit the container. So that way I know they're in there. So that's all done. We go over, so tacrolimus is all done. We're gonna go over to mycophenolate. It's another anti-rejection med, so very important. This one is 2 and 2. I'm just gonna double check that, even though I've been doing it for 11 months. These pills are nice. They're coated, they're nice and slippery. Just 2 pills. Super easy to grab. Mycophenolates are done. Sometimes I'll stack them up on top of each other, save a little bit of room. So now I'm gonna go over with my important pills. I'm gonna do Eliquis first. I don't wanna get blood clots. Now I might be out of this one right now. So I'm putting that one once again upside down. I'm gonna have to look to make sure that got mailed out. So I know in my head, I know I'm good until Thursday. It's also an easy to identify pill on these. So that's a full bottle. This is my Bactrim. I want to make sure I don't get sick. That's 1 in the morning. I know that for sure. Just verify 1 tablet by mouth daily. And that goes over there. It's extra Bactrim, pantoprazole. That's 1 in the morning. So when I first started, it's pantoprazole, carvedilol. So when I first started doing these pills, that's twice a day. You know, it was pretty daunting. You're fresh out of the hospital. You're kicked out of the nest. 1 a day, right? Twice a day. Once again, a little white pill looks almost exactly like prednisone. You know, it's intimidating because you don't want to get this stuff wrong. But after you've done it dozens of times like I have, it is a piece of cake. But don't get complacent because it is incredibly easy to mess up. So now I'm done with all of my pills that are super, super important to keep me going. Next, we can just hit up stuff like calcium. That's a big old pill twice a day. Got a broken one in there, so I guess I'll get some extra calcium one of these days. That'll be fun to choke down. A broken one will go in there for another day. I can already tell I don't feel like it next week. Some migraine medication. So I've got migraines due to paralyzed vocal fold. It's 1 in the morning, 2 in the evening right now. I had my left vocal cord nerve damage during surgery, and they're doing a surgery to repair that in June, and I get migraines from the neck muscles tensing up, which is not fun. Then starting on Saturday, I'll be going to 2 in the morning and 2 at night. Sorry, it's getting a little dimmer in here as the sun sets. Thought I'd be able to get this video done before then. This is vitamin B12. This is definitely one of those. If I missed it or doubled up on it, it wouldn't be the end of the world, but I was given it for a reason. I do have a B12 deficiency. D3, I've got short telomeres, so I'm at a higher risk of cancers, especially skin cancer. This is one my hematologist strongly recommended. Just one of these in a day. Did I miss one? Hope I got it in there. I did put calcium over there. Allergy medication, Minnesota. It is springtime right now. It's early May. All the pollen is out. This is a migraine medication that's just taken as needed. This is Zofran taken as needed. Methylcarbamol, muscle relaxer taken as needed. So that's how I do my medications. It is pretty dang easy. I like to start my day or my week off on Monday. I just do it on Sunday night. And I'm pretty excited. I've got 2 of these now, so I got 2 weeks worth. So I've got a few days left on that, because I actually started that on Tuesday. Got a little lazy. And now it basically takes just as long to do twice, and I don't have to set it up. So I got 2 weeks worth. So thanks again for tuning into Lung Transplant Channel. Hopefully you got some good advice on this one. If you have any questions, leave them down below in the comments. Like, share, subscribe. I appreciate it. And I'll see you on the next one. Thanks and take care. Appreciate it.